Hello, I'm Lucilia Prates, the founding member of Healthcare for All's Consumer Health Quality Council.
And I'm Deb Wackenheim, the Health Quality Manager at Healthcare for All. Thank you for being with us today. We're going to tell you a bit about the development of our Consumer Health Quality Council and the work that it's accomplished over its past almost 3 years in existence. Healthcare for All is a nonprofit organization based in Boston, Massachusetts. We work across the state on improving access to healthcare and quality of healthcare for all residents of the Commonwealth. A lot of people are familiar with Healthcare for All because we were very involved in the efforts to pass health reform in Massachusetts. As many of you may know, health reform did become law in April of 2006. And over the past 3 years, we have insured close to 97% of the population, and Massachusetts now has the lowest uninsured rate in the nation as a result of health reform. While we were doing a lot of House meetings and hearing concerns of those who we reached out to while advocating for health reform, we heard not only concerns about access, but also concerns about the quality of care. And between that and knowing that eventually, in order to sustain health reform, and just because it was the right thing to do, we would have to work on healthcare quality as well as cost containment, Healthcare for All decided to get involved in advocacy for healthcare quality improvement. And we developed our Consumer Health Quality Council. At Healthcare for All, we really saw a need to develop an educated group of consumers who could go and speak at these meetings and bring a consumer voice to all of the work going on in Massachusetts, both within healthcare and in the policy setting, to improve the quality of healthcare for all residents of the state.
The Consumer Health Quality Council at Healthcare for All is a council made up of people who have been impacted either personally or through the loss of a loved one. And we advocate to bring about change in the healthcare system and advocate for high quality, safe, accessible health care for all residents of Massachusetts. All of Healthcare for All's Consumer Health Quality Council work is consumer council driven.
Now I'll talk a bit about the work of the Consumer Council over the past few years and some of the accomplishments that we've seen. One of the main projects of the Consumer Council has been legislative advocacy. The first meeting of the Consumer Council was in November of 2006, and in January of 2007, a new legislative session was beginning in Massachusetts. We worked with the members of the council to brainstorm what could be some ideas for legislation that they would like to see introduced into the legislature in January of 2007. We talked about the experiences they and their families had had and what changes they would like to see happen in the healthcare system. From those discussions, we developed one omnibus healthcare quality bill that had a few different components. The bill required public reporting of healthcare-associated infections, public reporting of serious reportable events, prohibited payment for care needed as a result of a preventable serious reportable event, required hospitals to establish patient and family advisory councils, required hospitals to establish rapid response methods that would allow patients, family members, or hospital staff to activate an immediate response to the patient's bedside if a patient was deteriorating. It also had what is sometimes called an apology immunity provision, which allows a medical provider to apologize following an adverse medical event without that statement of apology being able to be used in a court of law. So it is seen as opening the door to allow some acknowledgement and apology and discussion between patients and providers. The omnibus bill also included mandatory disclosure following an adverse medical event, requiring full disclosure of what happened, the potential consequences to the patient's health, and what the provider would do to prevent it from happening again. That bill was introduced in January of 2007, and we worked throughout that year to testify at public hearings and to advocate to members of the State House in order to try to pass the bill. In early 2008, the Senate President in Massachusetts introduced a very large cost containment and quality improvement bill, sometimes referred to as Health Reform Phase 2 in Massachusetts, and that bill incorporated 4 of the provisions from our Omnibus Healthcare Quality Bill. And that bill actually became law when Governor Patrick signed it into law in August of 2008. Our Consumer Council has also served as a focus group for things like the Massachusetts Quality and Cost Council's website, which has healthcare quality and cost data on it, and for other websites with consumer information. We've done many media interviews telling our stories, talking about the success of the legislation over the past couple of years, and members of the Consumer Council speak at events and conferences, and we organize events in communities around the state to try to get more consumers activated around the issue of healthcare quality improvement. We also have an advisory committee, and we're fortunate that Jim is a member of our advisory committee. We have a quarterly quality newsletter, which anybody can sign up on our website to receive. Healthcare for All has a website and also a blog, which are updated quite often with information on health reform in Massachusetts and nationally, including healthcare quality and what's going on in healthcare quality improvement. And we work with other organizations to sponsor events on issues across the spectrum of healthcare issues. So thank you for your time, and my information is on a slide at the end of the presentation, and feel free to contact me at any time for more information.
Thank you.